Um, Actually, the back pain started without any calling. There was no symptoms. It started and the problem ये हो गया कि मुझे समझ में नहीं आ रहा था कैसे हो रहा है. Then I started going to doctors and doing lots of medication, but it didn't affect anything. Then I went for the Ayurveda stuff.
Yes.
It helped me, but it didn't help me properly. So I came across your page right now, few days back on YouTube, and that's how I felt like I should try you also because I felt quite confident after looking the video.
And this pain is constant or is like, I mean...
It comes, it erupts, it goes away, it comes, like that. It's vanishing and it's coming back.
Just bend forward. After this, do you feel any stiffness or this is your mobility limits or you can...
No, I can.
You can.
Yeah.
So this is what the maximum you can bend, right?
Yeah, exactly.
Yeah. Because of the misalignment of the pelvis, there's a lot of tissue tightness is there.
Oh, yeah.
It's not allowing you to go further beyond
Right.
this movement. Yes. Just go on your side.
There were times when I used to take my head below my knees.
Okay.
Yeah.
And after this pain and ache, you are not able to...
No.
Why?
मुझे 2 साल तक बहुत बुरी तरह से था. So I even can't sit in the bathroom.
So there is a problem at your L5S1.
Okay.
Your pelvis is a bit tilt on the right hand side.
Okay.
And there is some issues in the mid back also, like your T7, T8. There's a lot of stiffness here, swelling there. Yeah. And plus your neck. You have C2, which is like turned to the left hand side.
Okay.
Yeah. So it's a rotation of C2, I can clearly see this. Which shoulder you have problem?
The left one.
Left shoulder. The supply of the shoulder, the left C2s are. As such, pain in movement.
No, right now.
The end range is the
end range.
tightness here.
Yeah.
If you
Now,
go back, yes.
A very slight one. That also in this particular one.
Move your neck. Slow.
Coming back.
Yeah. Other side. Which side is more easy? If you try to look back both sides.
Right now for me, both the sides are easier.
Yeah.
Yeah, both the sides.
But this is your end range, and you can't go beyond this.
No.
Yeah. This is also not the original complete range what you had, because this is the section there. And you can see this could be a maximum.
Right.
It couldn't be maximum range what you see.
Yeah.
Just look up. Okay. Looking down. Yes. Straight. Fine. So we need to do some adjustment for your back. We will do that, and then after that we'll see how you feel after adjustment.
Thank you.
Just lie down on your tummy first. Just keep your hand on the back. This way. Yes. Any pain if I am pressing it here?
Right now, no. But the time that guy was your assistant was doing that physio stuff, I was having pain somewhere here.
This side. Right?
Yeah, exactly. Yeah, that's the point.
Just lift your right leg. Okay. Down. Lift the left one now. This you can lift more. Yeah, okay, fine. So this is more easier to lift. Just come to the right.
Actually, then I need to see myself again. But yeah, जब मैंने right leg उठाया, तो there was quite a stiffness even in my face also.
Okay, just relax.
हाँ.
Loose, loose. Because your pelvis is imbalanced, like it's more height on the right hand side.
Yeah.
A bit long leg, short leg is also present. Your right leg will be shorter than the left one.
Yeah.
Just relax. I will just adjust the pelvis first.
Just also I want to tell you.
Yeah.
3 years back, I had my appendix operation also.
Okay.
So I hope that just wanted to tell you that.
Sure. Just relax. Totally relax. Breathe in, breathe out. Relax. Relax. Breathe in, breathe out. Just take a breath in, breath out. Yes, breathe in, breathe out. Yeah, breathe in, breathe out. Total breathe out. Just relax, relax your head.
Yeah.
Total relax. Don't move, just relax.
Okay.
Relax. Relax your this side also. Yes. Just take a side turn to my side. Yeah. Come to forward. Yes. Bend this leg, upper leg, lower leg. The more you keep your body relaxed, it's easier for me to do that.
Okay.
Just hold your shoulder. Total relax your back. Breathe in and breathe out. Total breathing and breathe out. Now turn to the side.
Same posture?
Yeah. Come a bit forward to my side. Just relax. Right? Just relax. 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 Just relax. Yes, now you can hold your hands. Shoulder weight this side. Yeah, again, relax your back. Yeah, breathe in, breathe out. Very good. Breathe in, breathe out. Yes. A little straight. Just move your feet up and down. No, just feet up and down. Yes. Just come here on the chair. Just relax.
So it's a
No.
yeah.
Total relax. Just Totally relax. Relax. Totally relax. Breathe. Yeah. Right. Good. Just a small one this side. Okay. Just relax. Totally relax. Loose. Loose. Yes. Relax. Relax. Just relax. Loose. Totally relax. Straight. Loose. Yes. Good. Just move your neck now. Great. Other side. Very good. Excellent.
Yes.
You can see now.
Yeah.
The range is definitely.
Yeah,
Once you look back now.
yeah. This is my old times.
Yeah. Just walk. Let me just see your. Now bend forward. Okay. There is some tissue tightness is still there.
Yeah.
So that one goes out gradually because I've adjusted the spine, but tissue tightness goes with the time.
Fine.
You may need. You are here in Delhi for some time.
I'm there till tomorrow, day after also.
Yeah. So one more adjustment I can do
Fine.
maybe tomorrow, maybe day after.
Yeah.
So then after that, the complete flexibility will come back.
Great.
So one or two more bit adjustment we have to do one
Fine.
more.
Yeah, sure.
So then afterward, we'll see that when your flexibility, your pain, everything will subside. Later on, you just need to do exercises.
Thank you very much.
Okay. Thank you very much.
Thank you very
Thank you, viewers.
Yeah.
Please subscribe my channel for the new videos. Thank you.